Hi, my name's Dayna Harbin. I'm a psychiatric and mental health nurse in Springfield, Missouri. I always wanted to be a nurse as a little girl. I never outgrew that. I love helping people and working with people. I actually went into nursing school wanting to be a pediatric nurse. And an opportunity came up. I couldn't get into peds right away, and an opportunity came up to try adolescent psych, and I knew nothing about it. But I gave it a try and fell in love with it. And so most of my career has been child and adolescent psychiatry. And then in the most recent years, I had a chance to expand into a greater leadership role and be the director of all psychiatry. I went to school and got an associate's degree in nursing when I first started my career, and could work and do anything as a nurse with that. But I do love learning, and I wanted to know more, and I did want to get into leadership, so I got my bachelor's degree in nursing. And then more recently, I went back and got my master's in nursing education. A psychiatric and mental health nurse, in my position, we work in the acute care hospital, so it's when patients are in greatest crisis. So they're actively suicidal or they have severe psychotic symptoms. And so what we're doing is being in the hospital with them side by side. The nurse has to do a lot of assessment and observation. Unlike a medical patient where I can look at your labs and look at your x-rays and look at the wound and know what's wrong with you or how you're doing, I don't have any of that for your brain yet. So I have to talk to you, and I have to use my assessment skills and get you to trust me enough that you'll share with me what's happening in your mind, so that I can pass that on to all the other healthcare workers and they can make decisions about your care. So I spend a lot of my day assessing and observing and documenting what I see and what I understand about you. Another thing that's really different about psychiatric nurses, on medical floors, patients are in separate beds and you go from room to room. In a hospital for mental health, you're out with a group. We don't want you isolating, and you learn a lot from each other. So I'm not just managing each patient, I have to manage that whole group and make sure that their interactions are staying positive and healthy, and that you're learning from each other, but that what you're learning is the good things. And so that nurse is working with individual patients, but also monitoring that whole group. And then I'm a huge patient advocate, because a lot of mental health patients have a hard time speaking up for themselves, period, but mental health patients especially, because your brain isn't working right at the time, need somebody that talks for them and explains to their family what's happening and helps the doctors know and advocates for them. I get to make a difference. I get to feel like every day I touch a life. One of the things we talk about sometimes in mental health is most people who go to the medical fields, medical floors, are going because they're sick and they want to get well. A lot of times if your brain isn't working right, you don't even want to get well. You're hopeless. You think the world would be better off without you. So I have a chance to give you some hope, to make you feel like you can get better, you just feel like you get to make a difference and go home and I know I touched a life or changed a life. It's an awesome job. Study sciences, study psychology, look at getting really good communication skills. People in mental health need really strong listening and communication skills, so take opportunities to volunteer and get out. And it doesn't have to be with people with mental illness, but anything you've done in the community really helps you, I think, understand the mental health aspect.